next, it's on the topic of ethnicity and health. We've got 4 brilliant speakers today, and also a fantastic discussant, Samir Geraj from the Race Equality Foundation. So the way that we're going to proceed with the talks today is that we'll allow our speakers 12 minutes, and we're going to be enforcing time strictly. We've already started a bit late. But then we'll allow Samir to provide some reflections and to get the discussions going. And then we'll take questions from the floor. And you'll have about 10 minutes for questions. So, just to introduce our first speaker, this is Joe Moriarty from King's College London, who's going to be talking about social care data sets, ethnicity and access to services.
Thank you so much, and thank you very much for enabling me to be here today. I'm going to sneak in a bit because we know that one of the things that those of us who are interested in research funding have probably noticed, there's a lot more emphasis now from the National Institute for Health Research on ensuring that research includes social care perspectives. So I'm going to really talk about a project that we're doing at the moment, which is looking at the impact of the Care Act, and to use it as an exemplar for some of the data we could use that's routinely collected data that could be used to analyse ethnicity in terms of social care, but also to say, oh look, we've actually got to sort of have some caveats about it. Although it's useful, there are also some limitations. And just really to emphasise why I think it's important to use this routinely collected data is we know that with the rise of mixed method studies, there's a lot more emphasis now upon supplementing local data, a local project, with the national picture. The advantage of this sort of routinely collected data is that it's available over time. It gives us a long perspective over which to look. But unfortunately, somebody told me once a few years ago that they said that the significant factor about social care was that it was the only place in which Trotsky's concept of permanent revolution absolutely applied. And this is absolutely true, because what happens is that it's that they're always changing the way they collect data. The other thing, I'm just going to stop for a second now, because I've just realised that I changed it to I changed this to make it a little bit more readable, and I just want to, and now it's sort of slightly changed my, it's slightly changed the layout, so it doesn't fit very well. There, no, layout, do it properly. Sorry about that little, there, no, it's still not doing that. Anyway, so I must apologise for this fact that it's now, having changed the format, it's now gone a little bit loopy. But just to point out that in a report that Jabir Butt did in 1991, they actually pointed out that local authorities had started to collect data on ethnicity from as long ago as 1991, but actually the quality of the data was really not very good. And as I'm going to show, perhaps that things haven't changed too much. It's also important, I think, to have a quick reminder that social care funding has declined in real terms. So when we're talking about health inequalities and inequalities for people from different ethnic groups, we have to see it in a wider perspective, that fewer people are receiving social care than in the past. So the population of people who use publicly funded social care services is different from the general population. The tighter eligibility criteria and also the financial eligibility criteria to use publicly funded social care services mean that you've got that people who are experiencing health inequalities are likely to be, people who use social care services are likely already to be a very disadvantaged group. And we know as well that people who use social care services have got, often nearly always have long-term conditions, and many of them are living in poverty, particularly if they're reliant upon benefits. One of the difficulties, having said it's great that there's so much data about ethnicity, the problem is when you put it all together from different sources, you'll find that ethnicity varies in different settings and among different groups of service users. So if you look at among children, you find that children of black or mixed heritage are slightly overrepresented among looked after children, while Asian children are slightly underrepresented. Whereas if you're looking at older people, you tend to find that black and minority ethnic people with dementia seem to access services at a later stage compared with their white counterparts, so they're actually underrepresented. Anyway, the two sort of data sets I'm going to talk about for the next couple of minutes are the Adult Social Care Outcomes Framework, which is each local authority has to collect outcome data on this routinely and give this data back to NHS Digital, and it measures how well care and support services achieve the outcomes that matter most to people. So that's all very good. That looks really important. We can download the data, except for one of the problems is obviously it would be quite hard for you to see this, especially if you're sitting at the back, but it literally goes through the 152 local councils with data for each picture. So if we look, say, at places like, I'll give a good example, would be, again, it's not showing very well, but we've got Brent here. Now, Brent is actually a small borough with a very, very diverse population. So if we look at people who are of mixed heritage in Brent, they say we've got 5 people. So what happens with this survey? I'm really not explaining this very well because I've got a bad cold and my brain seems to have gone to my brain, really. One of the things, what the councils have to do every year is they send a sample of people using social care services. They ask them about the service they've received in terms of the extent to which it meets this Adult Social Care Outcomes Framework. So this is a sample of people in Brent who have completed this survey. And we see here that there are 5 people of mixed heritage in Brent. Now, Brent's a small borough. You might say, well, perhaps that's okay. If we look at Birmingham, though, Birmingham also has 5 respondents from a mixed heritage. Now, if we compare Brent, which is one of the smallest London boroughs in terms of geographical size and population, with Birmingham, which is the largest, I mean, it has over 1 million people using adult social care. So a million residents that, from which a sample will be using adult social care. Anybody who's ever been to Birmingham must know that there cannot be just 5 people of mixed heritage using adult social care services. So that's a sort of a problem with the data that's collected. And the other one I want to look at is the survey of adult carers in England, which again, it's a biannual survey, and councils with social services responsibilities are asked to seek the opinions of carers about the services they receive. Again, data that you can download, data available for all the countries, fantastic. Until we look at some of the options. Well, they've only got 2 options for gender, which obviously may not fit in with everybody's own thing. Ethnic group, carer. White, non-white, refused, not stated. How helpful is that when you're looking at, you know, groups that obviously might count as white in terms of white Irish, people from European heritage, gypsy and traveller people, and then non-white? I mean, it isn't particularly helpful, really. So, I won't talk about the national minimum data set. Oh yes, I will say a little bit about it. The other potential source of data about the actual staff is the national minimum data set for social care. One of the problems is that because people concentrate about ethnicity, they don't always collect data about cultural history. Like I know that we're going to hear about this in a later presentation. Religion might be more relevant in some contexts. Equally, migration history might be more relevant. So if we're looking at, we know that we always hear in the papers that the social care workforce is overrepresented with people from black and minority ethnic groups. But actually, if my former colleague Shireen Hussain, when she actually analysed the data, she found that actually there's a smaller proportion of black British people working in the social care workforce than we would expect, and there's perhaps an overrepresentation of people who have migrated to this country quite recently. So often things are presented, you know, in a way that's that needs to be more nuanced. The other point I want to make in my last couple of minutes is to say that we did a review for Age UK, which looked at diversity in older people and access to services. And we looked at various different services like befriending, full services, hospital at home. And we were trying to look at, well, what does this tell us about the protected characteristics under the Equality Act? One of the things that is absolutely striking is that many of the reported studies did not even report whether people from black or minority ethnic groups had been recruited. They didn't even report about the ethnicity of the sample. And obviously we know with the changing demography, actually, we would expect now to see a sample of people over 65 to be much more ethnically diverse than perhaps 20 or 30 years ago. So really the points that I want to make are that although there are a lot of potential useful sources in terms of routinely collected data from NHS Digital or from the Skills for Care, the difficulty is that often these data don't convey some of the nuances like migration history. They may not also record religion, and in some cases, religion may be more important than ethnicity. There's a lot of regional, we know that the ethnic population is different, is regionally, is not distributed evenly across the country, but there doesn't seem to have been any attempt made to say, actually, when we're looking at this routinely collected data, how far is it representative of the local population? The data does show differences in satisfaction and outcomes by ethnicity, and that's something that that's reflected in quite a lot of other research. And that's obviously could be linked to differential access, poor services, or differences in health. And so really there's a lot more potential to use this data in a better way, and particularly perhaps from the perspective of those of us who are using data to actually try and improve reporting standards so that when people say, when people talk about their research, it's actually routinely expected that they will report upon the sample in terms of their ethnicity. So, thank you very much for listening, and I hope I haven't gone over time.
Joe, that was a fantastic talk. Samir, any thoughts and comments that you would reflect on? Okay, all right. Okay, well in that case, questions from the floor. Any questions? I had a question. Really interesting talk, and you really highlight the sort of challenges of routinely collected data, sort of 5 people in Brent, 5 people in Birmingham. I spent a lot of time working with routinely collected data from mental health trusts, and within the mental health trust, there's a sort of auditing procedure where clinicians are sort of forced, essentially, to put the ethnicity. So we've got sort of 90% ethnicity codes. Now, the problem is around the quality of that, but we have better data. Have you got any thoughts on how that could be improved in terms of these sorts of data sources?
I mean, it's difficult. I think it's actually more about the sampling. I think when you look at most people now understand why they're being asked a question about their ethnic group. They do understand the rationale for it. And so they're less inclined to leave it blank in the past if they didn't consider they fitted in with a certain group or something like that. We know that people, were much less likely. I mean, a good example would be, I remember interviewing a Turkish woman, and I gave her the census categories, and she said, well, what do I put down? And I said, well, it's self-defined, they're not very good. I think, though, that the emphasis should be upon representativeness, on try and say, this is our local population, these are the results we've got. Clearly, there seem to be some discrepancies in the returns we have with the sort of returns we would expect. And to know whether that's down to, actually it's because they're not doing enough outreach with those communities, or if it's due to the fact that those communities are very dissatisfied with the services, so they get a survey about satisfaction and they think, this is rubbish anyway, why should I tell them what I think it's a really bad service. And I think that they're not, they have a lot of data, but they don't always. I mean, we know that in local authorities there are very few people who have a research background, so they don't always interrogate the data as well as they could. And they could actually make more use of public health experts, couldn't they, within their...
Okay, it's a question.
Is looking at people's income, routinely collected data on income by ethnicity, and I was wondering if you knew of any good sources for that, because obviously we're having trouble thinking about poverty and how we measure that.
Well, years and years ago, Jabir and I did it from the Race Equality Foundation. We did a project looking at quality of life and social support among people from different ethnic groups. And one of the funny things about the Family Resources Survey is that actually they were quite good at having a sample that was more ethnically diverse. So that would be a potential. I mean, I think one of the things we found was that it was very much skewed towards, because they didn't have enough interviewers who spoke community languages, it was very much skewed towards communities who were English speaking. And we know that, you know, there are some communities, like a good example would be Chinese people, where many of them, because of their working in the restaurant trade, they didn't always have a chance to learn English. You know, unless you've got somebody who can speak Cantonese or Hakka, you know, it's sort of quite hard to get them to take part in surveys. But I think the Family Resources Survey was meant to be one of the better ones in terms of ethnic representation, because we know that there's been a lot of work. I mean, Jay Ginn in particular did a lot of really important work looking at pension inequalities. So what she found is that although we think that in the population as a whole, women tend to have poorer pensions than men, hence, you know, the controversy over WASPI at the moment. But actually, if you look at it by different ethnic groups, you tend to find that white women are actually more advantaged than, say, British Pakistani men or British Bangladeshi men. So you end up with sort of quite complications of gender and ethnicity among certain age groups. So I think it's brilliant that you're doing this, because it's really really important.
There's a question in the middle there. So we'll just take one more question and then.
Thanks for the presentation. You talked about the potential importance of religion over ethnicity. Could you perhaps give some examples of how religion might tap into that? Because I was just wondering.
Well, sometimes, for instance, to be honest, the next presentation is going to take it. Are you the next the last presentation will deal with this much better than I ever could. But say, for instance, when you see data reported when they talk about Asian populations and they don't differentiate them by religion, you sometimes find, particularly if you're looking at income, you might find that we know that among Asian people of Asian Indian backgrounds, their income tends to be higher than people of Asian Bangladeshi and Asian Pakistani backgrounds. So sometimes, if you're not going to disaggregate by ethnicity, it could be more important. And also, obviously, if you're looking at things like social support, religion may be a factor, you know, that isn't there. So I think sometimes it's about deciding when ethnicity is useful, and then at other times deciding when it would be good to break it down by religion as well.
Okay, thank you very much.